Hello, friends. Today at Hpathy Hot Seat, we have with us Dr. Vijaya Patil. Dr. Vijaya Patil is an international educator and specialist in pediatric neurodevelopment disorders with over 3 decades of experience. From leading government-backed research on childhood autism and training practitioners worldwide via TQFS Academy, Dr. Patil has dedicated her career to treating complex cases of ADHD, dyslexia, and chronic pathology. She is the founder of Sparsh Homeopathy and a leading voice in bridging the gap between basic science and homeopathic therapeutics. She is also an international speaker on homeopathy. Dr. Patil, a very warm welcome to Hpathy Hot Seat.
Thank you, Dr. Manish Bhatia, for the introduction. And very great. I'm feeling very great that you have invited me for this hot seat, and great to see you all.
Thank you so much. So, my first question would be to know more about your journey. Could you take us back to the beginning of your journey? What was the specific catalyst or clinical case that first led you to apply homeopathic principles to neurodevelopmental disorders like autism, ADHD? And over the years, how has your approach changed and evolved?
When I started my practice long back in 1990, like, so it was a private practice, and I was not knowing anything about these cases. Like these cases used to come to me like hyperactive children, people with delayed development, delayed talk and all. And I used to treat them like, normally we take the symptoms and we prescribe. Like, so, but slowly, I found that I'm not getting results in that. I'll give you one example. Like one child had come with very hyperactive child with delayed speech. So I took restlessness in children, delayed speech like talk, slow learning too, and all. And based on that, and he was a very lean, thin child and all. And I prescribed calcarea iode. That was my first child, and I prescribed calcarea iode, right? Because he was lean, thin, and restlessness in children, and he had some fears and all. But then it was not working because this I understood later on when I started treating ADHD children. Because in that child, the restlessness was not the characteristic of the child, it was the characteristic of the disorder itself, the ADHD, which I was not knowing at that time. Because maybe in our curriculum, these all disorders are not taught in detail, at least at our time
True.
that time. So slowly, I felt that there is a need that why I am not getting results in these kind of cases. So I just moved out of my private clinic and I had the opportunity, great opportunity to work with Dr. Praful Barwalia and Spandan Holistic Institute at Ghatkopar. And there the real journey started. Like there we were seeing so many cases of hyperactive children, ADHD and autism, dyslexia, that we were now our training started how to approach these cases clinically also as well as homeopathically also. So the so many patients there, slowly we learned. See, at that time I was frankly speaking, I was not knowing what where to read. I was not knowing about DSM, nothing. So there the journey started, that what books we have to read for these kind of disorders. Because these are, see, nowadays Google is there, everything is there, you can Google it out, but the real thing, where it is given. So we started reading DSM-4, DSM, Kaplan Psychiatry, all, and there we got the knowledge that these are the disorders which we will cannot tackle like we tackle any other case in homeopathy. We will, unless we know about these disorders, we will not be able to, differentiate between the common symptom as well the characteristic symptoms. So what I used to feel as the characteristic symptom of the child, actually they were the common symptoms of the child, and that's why I was not getting the results. So the whole scenario changed after when I started reading, when we started seeing these children, and then we got the opportunity to work in the research, autism research also, and it was all structuralized. like how to approach. You cannot just say when a hyperactive child comes, oh, he's ADHD. No, it can be just hyperactivity. You have to really, because it is a child, you are labeling the child, it will have repercussion on his future, on his parents. So you really have to be very specific while telling the parents that your child has ADHD or it is just hyperactive. So first you have to be sure about it. And for that you have to be sure about it, you have to have the detailed knowledge about it and how to diagnose specifically so that you are not haywire in telling that the child has these disorders. So actually from Spandan, it all changed. And then we came across the scope of homeopathy also in this, there, what we can do in these kind of disorders. So the journey started from there.
But a lot has changed since that time. I remember in 1990s and even 2000s, there were so few doctors, uh, especially homeopaths, who even knew what autism or ADHD was. And we have seen now a significant shift in how neurodivergence is diagnosed and perceived. So, from your perspective, what are the most notable trends in ADHD presentation today compared to a decade ago, and how is homeopathy uniquely positioned to meet these modern challenges?
Uh, the trend has changed in terms of, uh, previously they were underdiagnosed, you know, because previously, I will say the awareness, the knowledge, which is fast gaining now in this era, because of all the digital media, or maybe nowadays why the diagnosis is increasing, because every child is a precious child. Previously, no, we used to have five children, and what the children are doing, parents never used to bother. Now we have only one or two child, and parents are so much bothered about them that they are very observant about them. And anything deviating from the normal, or they are not performing academically, so they immediately seek help. So the trend of underdiagnosis has now changed into a overdiagnosis, I will say. Because every child, now the parents are coming to us, that see, you see, my child is having ADHD. So you have to be really evaluate that, really you have to tell them ki yes, it is ADHD, or no, it is not ADHD. So again and again, I'm telling ki we have to have that knowledge to, so that we can guide the parents correctly. Now the changing trends in terms of, see, previously, now in smaller children, we used to see lot of hyperactivity, impulsivity, and disruptive behavior. Temper, tantrum, destructive behavior, and all. But as the child grows, this hyperactivity, impulsivity changes into inattentiveness, and most of the child, they come after 7 6 7 years, because now they are in the school and the complaints are there from the school. Till the time the child is at home, parents feel okay, he's mischievous, he's little hyper, grandparents are there, okay, he will become all right. But the moment they go to the school, the real problem is detected. And then the parents come to us saying that no, school has suggested that he should go under some screening, that way. So, as the child grows, no, in nowadays we are seeing adult also, many adolescents. Like on that day, that 16-year girl came and she is telling, ki, probably I'm having a inattentive ADD, inattentive type of so nowadays, I think the education is there, the awareness is there, and also there is a change in the stigma. Previously, parents used to hide it, ki my child is having autism, my child is having ADHD. Now they are seeking help, because I think they have come out of that, ki no, we have to help our child more than bothering about the stigma. So I think the diagnosis has improved, the number of diagnoses, they are more diagnosed nowadays. and many, all children as well as adolescents as well as adult. Now one adult had come with the thing that he's changing jobs frequently, and that was then later on diagnosed that he is a inattentive child since beginning. So now the trend is like the children, the adolescents, the adult, all are becoming aware of it and they want to seek help. Also, I'll tell you why the change is there in terms of diagnosis, because there is a change in the DSM-4 and DSM-5 criteria for diagnosis. Like DSM-4 used to say that it should start before 7 years of age. Now DSM-5 says it can start before 12 years of age. So you are broadening the area. So more and more people are coming into this uh, area of diagnosis of ADHD, because now the age is also changed, from 7 it has become 12. Also DSM-5 has changed the criteria from uh, for adult 5, it was 6 out of 9, now it is 5 for adult. So the range is increasing, no, so that's why the number of diagnosis also is increasing.
So I see so many ADHD patients myself, and most of them are taking Ritalin and Adderall. Uh, how does homeopathy compare with what the conventional medicine has to offer?
Yes. See, many children, what we are getting, they are already on Inspiral. Inspiral is the drug of choice they give,
Yeah.
and they give it in the morning. Mostly it is given in the morning so that the school time, the child will go to the school, he will be calm and quiet there, and he comes home, and at home again they can see that hyperactive symptoms. So when we are dealing with such children, no, we tell them, I, at least I never stop immediately all the drugs. I tell them that I will start my drug, and slowly we will reduce the drug. And over a period of time, we have stopped many children with all this Inspiral, and they are totally on homeopathic. And many times the parents themselves, they stop the treatment. So then we don't have the say. So we say, okay, we will see. So with Inspiral and all, like yesterday only, I got a case of ADHD. He is on Inspiral. Now there is a gap of 1 month. The child will go to school next June. So they said ki we have stopped the Inspiral. Now we want him to be on homeopathy. And after they said ki with Inspiral, he was quiet, but his appetite had decreased. His sleep was disturbed, and there were a lot of anger irritability issue. Hyperactivity is reduced, but the anger irritability has increased. So people are also understanding now. See, previously this understanding was not there, but nowadays parents are very smart, very educated, and they know that what is good for their children. So they stopped of themselves when they came yesterday. So it was okay for me. We started with homeopathy.
So for our audience, I would like to share that Inspiral is methylphenidate, another name for Ritalin. And there's a very, very famous book in homeopathy, Ritalin Free Kids.
Uh-huh.
Yeah, so those who want to learn more about uh, how to get their kids off Ritalin or methylphenidate, they can read this book, or better still, join your upcoming webinar where you're going to teach us all about how to treat ADHD kids and with homeopathy. So, what has been the change in how you have been treating ADHD kids over the years, and what has been the success rate like?
Yes. See, the homeopathic principles, what we are applying, that will be the same. They will never change, right? It's only we grow with the time, with the number of cases we are seeing. And with that growth, I have seen that homeopathy has a lot of scope in these children, because, as you know, that ADHD doesn't come alone. It will have many comorbidities along with it, many other things which we have to handle. Like we have children with ADHD, with autism, or with autistic traits. We have with sensory system impairedness. We have language delay. So all this has to be handled collectively. Only not ADHD we are handling. So with that, to handle all this, we have to have all the knowledges. How to now, these cases, only homeopathy, if you will treat them, maybe it will be a longer, it will take longer period. But if you add occupational therapy with them, if you add sensory integration therapy with them, so the progress will be faster. That's what we have seen. See, we have seen cases where the child was already on occupational therapy and child was not progressing well. So we added homeopathy and the child started progressing. So we have many cases, we get many cases where a child is already on therapies and they seek now it is like, see, we have been practicing here since so many years. All the therapists they know, so they themselves send the patients कि okay, therapy is going on, you add homeopathy. They will never advise ki go for Inspiral or any other allopathic medications. So that way, uh, uh, all the knowledges which we should have in treating these kind of disorders, like all these therapies, now family has to be handled with this kind of kids. The plight of parents. These children may go for dyslexia, so you have to have all these knowledges. Like you cannot say ki I am expert in ADHD. No, you have to be expert in all the neurodevelopmental disorder. You cannot be expert in one neurodevelopmental disorder
I
because they
totally
all will intermingle with each other.
Absolutely, I totally agree. But offhand, do you remember any memorable cases, any transformative cases where you were able to see the miracles of homeopathy?
Yes, yes. See, I had many children. Now they have grown up. I have few children who are now 16, 17 years old. There are many, like one child, he was hyperactive and more than, and they always have some sort of some form of intellectual disability, or they are dull normal or in the milder category. So it is all intermingled, what symptoms is due to ADHD, they are delayed development and all. So this child had in the borderline zone 70, the IQ was around 70, 75, and he was very hyperactive. But many and what difficulty we face in these kind of, that there are, these are one sided cases. The symptoms, the characteristic symptoms are very less. And what I remember, that I have given in this, on 2 to 3 symptoms I have given medicines, and it has to be characteristics. Otherwise the medicine will not work. On the common symptom, medicine will never work. So now this child was very hyperactive. What in his hyperactivity, what was the quality, that you, anything comes into his hand and he will throw it. This was the thing. Like in there, so many, TV, so many antennas, so many remotes, all were broken. Because the problem with the mother said, ki you just treat this. He may not go to school, he may not perform, but you just treat this. And with tube, and see, there were no other symptoms. Now, if you see the repertory, in throwing things also, that remedy is not there. That's why it took so much of time. But then on inquiry, it was he had craving for banana, intense craving for banana. And that, and he was very in the future, last he used to have recurrent upper respiratory tract infections. So based on these 2 or 3 symptoms, I gave him tuberculin. With tuberculinum till today, the mother comes with the child till today also, and she says ki after that, the throwing thing has stopped. So sometimes, no, it is very, so many medicines you prescribe because there are no symptoms in these children, characteristic symptoms.
Uh,
And sometimes something strikes and the whole case gets resolved.
I totally agree with this. Some of these cases are really symptom deficient. And I remember there was a case, autistic child I was treating, and I could not get like anything characteristic in the mother's history, in the family history, and the child was young. The only thing characteristic I got in that case was that the child was very, very fond of eating tomatoes.
Uh,
Like he would open a fridge and eat a tomato. So, and the only remedy at that point of time in our repertoire was lycoperdicum,
yes, yes,
which is nothing but tomato.
yes,
Lycoperdicum is prepared from tomato. So because I had nothing else to prescribe upon, I gave that child lycoperdicum, and to my amazement, the child improved significantly. So some of
yes,
these cases are really symptom deficient. I totally agree. But then there are a lot of cases where we do get very good family history and
yeah.
miasmatic history to base our prescriptions upon.
Yes, yes. Yeah, yeah, I agree. Sometimes I think, many times you have so many symptoms that you are not sure which is the common and which is the characteristic. This
True.
also happens, but in difficult cases, I'm telling you, like where you have deficient.
So, do you have some in your very long clinical experience? Have you seen a group of remedies get being indicated more often in ADHD cases?
Yes, yes. See, as I told you, no, previously we used to give calcarea iode and delayed development baritas and all, but we never thought of. And see, previously, now I will say ki we did not have digital repertorization previously. Now we have digital repertorization. The repertories have come up with so many remedies and all, and we are now more accustomed to use these repertories and come to a broader group of drugs. So definitely there are some drugs which are more for ADHD. Like I will not say all the drugs, but what I have come across is the stramonium group, tarantula group, theridion, uh, snake group. Snake groups comes up very commonly. And but I have seen that many times, no, like other drugs, apart from this common, no, lycopodium comes so many times. We cannot think of lycopodium in ADHD, but lycopodiums, I have so many cases of lycopodium,
Totally
like
agree.
huh. And many times, no, a single symptom. I'll tell you because I can tell that case of, because the child, no, he will start talking and then he will not be able to finish the sentence. I'll start him something. I will ask him something. Ki, what happened today? What did you learn in the school? So we'll start from there, and he will go to the playground, and then he will come home, and matlab, he will continue, and parents has to tell him that now stop. Okay, this was not asked to you. So there is a rubric in our repertory. Sentence cannot finish. Now, in this child, what is the reason? I was knowing because he was a little inattentive and he had some intellectual this also. So he was confused about the what to talk and where to stop. But this rubric is there in our repertory. Sentence cannot finish, and there only one drug is there. I think onosmodium, which I never thought of. Ke onosmodium can come in this kind of children. And when I went to read, this is the beauty of repertory. When I went to read that onosmodium was covering all this kind of, confusion and confusion in distances and mistakes in writing and speaking and everything. And I never read onosmodium from that point of view. So I think uh, any remedy, if characteristics are present, we can explore any remedy in these uh, disorders. So I have
Great.
common remedies also many, but I have few, where I was also astonished ki how this remedy can come up. Like,
Great. Dr. Patil, you are going to conduct a webinar on ADHD on 23rd of this month at Hpathy Global Academy. Tell us more about that webinar. What are you going to teach, and what are the takeaways for the students there?
Yes, yes. Uh, First, though, thank you for giving me this opportunity to take this webinar, because I will be able to share everything what I have learned throughout my, all these years. So, what this webinar I have, given concentration on what is needed for a practical approach to ADHD, like not theoretical. Of course, I will discuss theory about ADHD, about how to diagnose and all, but practically how you can in your clinic. Like, see, Abhi, now we have so many psychological screening sheets for ADHD. Like, so we will discuss that, but then every time it is not possible to send you to a psychologist. It's expensive also. Parents also don't agree. So you can have some screening sheet in your clinic. You can just tick the criteria and you can come to the diagnosis. So you're sure that you are dealing with not hyperactivity but an ADHD child. So this way it will help you to ground yourself in terms of diagnosis. Also, like when we are dealing with ADHD, as I told you that in our colleges and all these disorder, I don't know what is the scenario now, but these disorders are not taught in a detailed manner. And when I'm telling you ki when we are dealing with ADHD, we are not dealing with ADHD. We are dealing with all the neurodivergent. I have to know about autism. I have to know about, disruptive behavior. I have to know about language delay. So how we can, do a comprehensive diagnosis. It's not ADHD only, but he has associated intellectual disability. He has associated language delay. So you know the therapeutic problem definition, what you have to handle in this child. And on that basis, you can plan your therapeutic plan for resolving all these problems. So, in clinic, how you will diagnose, how will come to a therapeutic problem definition, and then how you will make a plan to resolve it. So, this will be a clinical aspect. And in that, one more aspect is early diagnosis and prevention. See, nowadays, once it is happened, it has happened. You can treat it. But more should be on the uh, prevention point of view. We should give importance to prevention. So how it can be prevented? So you have to know right from the marriage, pregnancy, what precautions has to be taken so that this will not happen. You have to educate the parents also, because when you are treating the parents, they will go for second child. So what precautions they have to take? And see, ADHD is a mental disorder. We don't have any biological parameters or any imaging to diagnose this kind of disorder. So we have to depend on the history, family history, and all the pregnancy history, everything we have to take in account while we are taking the case. So that is very important. So from clinical to coming to the homeopathic part, the detailed case history, which we will require from clinical point of view, from preventive point of view, also from our homeopathic point of view in terms of miasms, in terms of causation. Because we can get our PQRS in maternal history also. We can get PQRS in birth detail also and development detail also. So how that history has to be taken, so that we are in homeopathy, we are constantly, our main aim is to search for PQRS apart from the miasmatic family history, past history, and all. So, how to take full case so that you can tap all the areas so that you can find your PQRS from any area. And once you find, and main thing when you take the full case, no, the full case is jumbled, with symptoms. because these are mental disorders. So the emotions, the fear, the behavior, the common symptom, everything will be jumbled. It will not come into categorization, it is physical symptom, it is mental symptoms. So you have to really struggle to differentiate between the common symptoms and the characteristic symptoms. And even if nothing is there, how these common symptoms can become characteristic. So, main how to form the totality. So, after forming the totality, how to differentiate all these drugs. And these cases require long period of treatment. It is not that they will come for 3 months, 6 months. You need to treat them for a longer period of time. So the patience which is required, what are the criteria on which you will judge that you are on the right path and you will continue with the medications. So these all will be taught along with the holistic treatment, as I have told you, that you need to know occupational therapy, you need to know sensory integration therapy. So you will have to guide the parents that what measures has to be taken for this child in a
And I believe you
holistic
would be
way.
sharing many cases also.
Yeah. With cases only. See, theory to we are sharing only, but theory is no unless you practice it with cases and all, no, and cases with detailed follow-ups and all will be shared, so that and people will know that not just ki how this potency has to be raised or when you have to be observant and when some phase remedy will come up, so you have to be alert. Then you can give the phase remedy. Then the vital force will unfold, and then some new totality will come up. So in children cases, you have to be little alert and observant to see all these phase remedies or
Great.
miasmatic remedies.
So this webinar looks very, very comprehensive to me, right from diagnosis to case taking to therapeutics to repertorization, cases, follow-ups, management. You seem to be covering a lot of ground in these 3 hours,
Yes, I
and yeah, so it's
hope so.
commendable. It's commendable,
Hope
and
so. People should like it, and I know they will definitely like it. And it's my little effort so that my experience should go to others and help them in dealing with all these cases.
I'm sure this would be very, very useful to uh, every homeopath as well as to a lot of parents also
Yes,
whose children suffer from ADHD. I believe it's going to be useful for both, and we
yes,
all
yes.
are looking forward to it. And friends, if you would like to join this special webinar by Dr. Vijaya Patil, where she would be sharing her learnings from her past 34 years of clinical experience on in treating ADHD with homeopathy, do join in. Please visit hpathy.org, hpathy.org, and right at the homepage, you can sign up for her webinar. And we look forward to seeing all of you there. Thank you so much, Dr. Vijaya, for sharing this useful information with all of us. And we look forward to your webinar and much success to you. Thank you so much.
Thank you. Thank you very much, Dr. Manish Bhatia. I feel honored to be here. Thank you very much. And
All
waiting
right.
for you all to join the webinar.
Have a good day. Thank you.
Thank you. Thank you very much.